Welcome to the Our Forever Smiles podcast, a podcast created to support mothers of children who were born with clefts and those who love them. I'm your host, Laura Arroyo. Hello, and welcome back to the Our Forever Smiles Cleft Mom Diaries and Support podcast. I am Laura Arroyo. Before we jump into this episode, I would like to invite you to join this community to hear conversations with other cleft moms and professionals and advocates that will help you feel supported along your journey. All I want you to do is click on the follow or subscribe button. We love your support, and it's incredible to see us all come together. So thank you so much for subscribing. As a note, we do have a doctor on the podcast today, but she is not your doctor. And so we do not intend for you to use the information that we share here as medical advice or any diagnosis or anything like that. We are parents and advocates who love our children, and we are sharing our own personal experiences. Today, we have Dr. Anna Thurmes. She is a professor and team member of the University of Minnesota Cleft and Craniofacial team, where she was also a patient. Oh my God, how endearing. She was born with a cleft lip and palate, which has fueled her passion for helping others on their cleft and craniofacial journey. She is a speech language pathologist and holds a PhD in family social science. She is also a published author, speaker, and very exciting podcast host. Welcome, Dr. Thurmes.
Oh, thank you, Laura. Thank you for all you do. What an incredible, I know it's just out of love you do this. So thanks for what you do.
Yeah, thank you for that acknowledgement. Today I had posted, I try not to I try not to mope when I have like bad days or like share that I'm having like a hard day or week. I think it's mainly because sometimes I feel like, it's the internet, right? Like who cares if you're having a bad, nobody genuinely really cares. And it's kind of like a negative way to think. But today I had actually posted that I've been having a hard week, and it's a lot. I mean, the podcast is a lot of work, and it's interesting I know that you recently launched a podcast as well. And so you understand that this idea that it's a lot of work with no return, And I think that I have certainly, people have reached out and they've thanked me, and I get that feeling from people that it's really helpful, right? And that it has been helpful to other people. And so I kind of really needed that this week. Like I really needed like someone to say like, keep going, because I definitely have been having that feeling like, how long can I sustain this? So yeah. Anyway, this is not about me. This is about you today.
Well, I was going to say that, it's like the cleft journey and my journey of like, there's all this stuff with the cleft and craniofacial, but there's life still happening, right? And so it's that balance. And I just know my mom would have loved something like this, because finding other people on the same journey wasn't like how it is now. And part of the reason it is like it is now is because of what you're doing. So you never know who it's going to touch and when it's going to touch. So
Yeah.
I see you, I hear you, and it's amazing work.
Thank you. I appreciate that. But, along those same lines, I've been following you for a while now, the Cleft Collective and also the University of Minnesota Cleft and Craniofacial, the team page on Instagram. And it's so funny. I reached out and you're like, it's me, Anna. So
Yeah.
Yeah. Like how incredible it is to work somewhere where you were a patient. And I don't know if you're even finished with all of with surgeries, and we can talk about that as well, but just even you have such a unique lived experience that I imagine bring to work as well. Like I imagine everyone is like all ears when they're talking to you, or how
Yeah, I mean, it's a deeply personal journey, right? I'm sure your listeners can relate to this. And so there's no way I can separate. And that's a good thing, right? And just being able to support them on their journey. So I was born with a cleft lip and palate and had, was very used to going to the team, but I got shuffled between providers as a child because every time insurance would change, we'd have to switch teams. I have some really strong memories of my care growing up, and part of that was hating going to the doctors. I always felt like I was super observant, shy, and withdrawn, but I was always listening and processing what they were saying about me. And that was a challenge, right? Like we're not, it's hard to take criticism as an adult, but as a kid hearing like, well, this is a little crooked or this, this could be tweaked. It wasn't until I was 14 I landed at the University of Minnesota team, and it's a couple providers that changed my life. What they did was they talked to me first and they listened to me and really showed me like this team care thing, it's about you and you're the leader of this team. And so that was the huge change in my life of like I went home from that visit and I told my mom, "Mom, I want to do what he does when I grow up." So I had made up my mind, like I want to help change lives, like he just changed mine.
Hi, I am so sorry to interrupt the show, but I just want to tell you about today's sponsor. Today's show sponsor is Sienna Darn Media Integrated Marketing Agency. Sienna Darn Media is more than just a marketing agency. They are your partners in progress. Their mission is simple: to alleviate marketing bandwidth, allowing creative business owners to focus on what they set out to do: create. Sienna Dawn Media empowers creatives to thrive without the burden of managing their own social media and marketing campaigns. Visit siennadawnmedia.com. You know, we actually had Scott Crampton on. He had actually been featured on Shark Tank, and he was born with a cleft lip and palate as well. And he mentioned that very thing to me, that he said he remembers vividly being in a room where people were talking about him and not to him. And it's a very strange and like maybe even like objectifying a little, like a very weird position to be in terms of like you don't really feel involved in your care at all. You kind of just feel like just someone in the room, you know? And is that kind of something that you experienced as well throughout your journey?
Definitely early on, and I think it's really important for listeners, like healthcare has shifted, right? So 40 years ago, medicine was much more like that's how physicians were trained. And so I think it's definitely shifted, and we're not training providers to practice that way. But I can say, like, it takes extra effort as a provider to make sure, okay, we're talking to the child first or the parent. And I always tell my parents, I call them my parents, but like model how you talk to the doctor, how you want them to talk to your child
Mm.
too, because yeah, I mean, they're listening to what you say as a parent too, like how you ask questions and um, so there's a huge opportunity at a young age to make kids feel empowered in their journey.
Yeah. And when you finally landed at the University of Minnesota, was that the first time that you'd seen that kind of, what do they call that? Is it multidisciplinary approach where you're like visiting, you have one visit and you're seeing like the whole team for that day?
It was not my first experience. Like I had teen care from an early
Hmm.
age. It was just different. So the first team I went to, they had their team meeting, and like even when they saw you, all the doctors came in at one time, and then the team meeting was in front of me, and they would, so here I am 10 years old and it's a room full of doctors and they're asking me what questions I have and like, are reviewing things. So I have this vivid memory of kind of that previous team asked me if I had questions, and I remember asking them, "You said I am beautiful. So why can't you leave me the way God made me?
Mm. Oh, wow.
And then my other questions were, I didn't understand why I needed a bone graft. And so they told me why I needed it. And I said, okay, thank you. I'll take dentures. So, like, like looking back, I think a lot of that was a fear of surgery,
Yeah.
right? Like, yeah, I didn't want surgery.
Yeah, but I mean, I think that's really interesting though, because I think people go into surgery like, okay, this, like, I'm going to, be quote unquote fixed, right? Like I find like a lot of cleft affected adults and individuals that I speak with that they are kind of excited for the next surgery almost like, or like there's some feeling around it that like, okay, this is going to be the one. And I find that admirable in you because it's kind of an insight into the type of child that you were. Like
Mm,
obviously probably things were happening in school and different things were opinions were coming your way and you kind of decided, right? Like, no, this is the way that I want to do it and I don't care, right? Like if you're saying that I'm beautiful, then why can't I just stay this way?
leave me alone.
Yeah. Versus like other people may have this feeling like, okay, this is going to be the quote unquote fix. Like this is going to be the thing, this is going to be the last one or the one that I need. That's, I'm going to wake up and be different. Um, and so did you,
Mhm.
I guess in thinking back in your childhood, do you remember yourself if there was a moment that you felt like, okay, I am different, like I'm having all these doctor's appointments, I'm having surgeries that kids aren't having?
Yeah, I think I always kind of felt like the other, like I was going through something that other kids weren't going through. I had a lot of speech problems. No one except my sisters really understood me until I was 5 or 6 years old. And so that definitely shapes how you interact with the world, right? And so I was rather shy, but I was also this strong, fierce, independent. Like at home, I was not shy, but out in public, it was like I was shy. And so I do always remember feeling like I'm going through something other kids my
Mm.
age don't go through. I do remember, like, I have memories of early elementary school of kids asking, why, what's that on your lip? What's that? And I remember, like, I would go home and I would just be sad. And my mom did such a good job of just pulling it out of me. Like, what is going on in that little mind? And then the tears would just come. And then that's when she taught me, like, you tell them this, I was born with this and I have a scar. And where's your scar? Like, do you have a scar?
Mm.
So really like that strategy of like explain and then switch the topic back or question back to them. And then I remember doing show and tell where I brought in my ear tubes that had fallen out in a little case. But it was really good for me to be able to like one practice speaking and that confidence. Like I needed help standing up and people looking people in the eye. So those are kind of my early memories.
Yeah, and thinking just about your mom as well, like, have you ever been able to have that conversation with her about when you were born? I know ultrasounds were, I mean, I've only heard of one person that said that they had an ultrasound. I know even myself, my mom was like, we didn't have ultrasounds during that time. So it's just like you just got what you got, you know? It's like surprise, they're here.
Yes. Exactly. So I was a surprise, and most of the time when the baby is born, like let's say you don't know the gender, right? They say it's a girl. And my mom does tell the story of she didn't hear those words.
Mm.
She heard it's a cleft.
Mm.
So those were her first memories
Yeah. Has she ever talked to
for
you about
sure.
how, like what your treatment journey was like then, like when you were a baby and what she had to do to kind of care for you and feed you?
Yeah, I think if you ask her, she would like never have guessed I'd be where I am now.
Really?
And so if I could just tell moms like or listeners like just like dare to dream all your child is going to become because I bet they'll surprise you. But my early journey was very stressful. There weren't a lot of tools then for feeding. And so my mom does tell stories of working so hard to feed me, and then it would all come back up. She used her go to tool then was a turkey baster.
Hmm. I've heard of that.
And so, yeah, I was failure to thrive. Even in early elementary school, I was still drinking whole milk. And yeah, and so it was a lot of speech. I had a pharyngeal flap when I was 4 or 5. So it was not a fun beginning for my mom, for sure. My mom tells a story of how difficult, like early on, school was for me, especially because of my speech. And she, like, kindergarten, the principal, I went to this private school and it was kindergarten. The principal said, I really think you should take her to the public school. We don't have what we need here.
Mm.
And my mom, thank goodness, she put her hands on her hips and said, "You will teach her."
Oh, wow.
Um, so she advocated, and those smaller classrooms were just what I needed. So
Yeah, I love that. Do you have any other siblings? Or are you the only child?
I'm the middle, so I'm the second of 3 girls.
Oh, wow.
So they were my bestest pals and my translators. They understood my speech just fine.
Yeah. Well, and just in talking about speech, and you've mentioned this a few times. And so is that you did mention like you wanted to kind of go into this work because of that, because of the struggles that you yourself had with speech. How did that journey begin for you? I mean, obviously you've gone to school and done all of those things. Where did you start?
Become as far as becoming a speech
Mhm.
therapist.
Yeah.
Yeah, so like I said, when I met Dr. Moeller, I knew I wanted his job. And when I wanted his job, it was really being able to like guide people and offer family-centered cleft care. And so my mom called him up and what are your degrees in? She wants your job someday. And it was actually
That's so sweet.
actually in speech therapy. And I said, "Oh, I would never want to be a speech therapist. All they do is work on people's S's, the S sound, because that was my last sound I had to work on." But after I did research it, it was a really good fit for me. And so I went to my undergrad and then got my master's in speech. And the whole time through my schooling, worked with the cleft team. So,
Oh. So
yeah,
you were already set, like, I wanna work on the cleft team, like, and not just any speech, and language pathologist, but you really wanted to work with cleft-affected children.
in
Yeah.
cleft. Yeah.
Oh,
Yeah.
that is wonderful. And
Yeah.
then the family, social science part of that, where does that kind of come into play into the cleft journey? And I guess where do these 2 roles kind of intertwine?
About- well, it's a long story, but I really loved being a speech therapist and I still practice. But when it came to research, I was really fascinated, like what support do families need to be able to get through this journey and thrive. I was fascinated, like, what can I do as a speech therapist to make sure families have the tools they need to, one, do the home practice, right? Because
Mm.
parents spend the most time with their kids. So we know home practice and integrating that is huge for making progress. And I was just kind of like so curious, like, how come sometimes families come back and everything on the checklist is done, and then other times it's like nothing's been done and now care is delayed? And so my research ended up focusing on measures of quality of life for moms and children and what were kind of, I'll say, predictive factors. So I looked at, does family centered healthcare
Mm.
improve quality of life? And it turns out that is significant, and along with the severity of the condition, but more than severity, more than family-centered healthcare was social capital.
Mm.
So what resources and support do families perceive they have? So not too surprising, right? You know all about
Yeah.
that.
Yeah, no, I think that was like a major thing for us. In starting this journey, I felt like we were so alone. Well, I was alone. I think I didn't really want to talk about it much, which is surprising now that I have a podcast. But I just didn't know what to say or what to do, or and it wasn't actually until I found like the Facebook groups and stuff that I realized, like, oh wait, like, 1 in 700, or whatever the numbers are now, but like I'm really not alone at all. Like there are quite a
Mhm.
few folks that are dealing with the same thing. And so it was really, really shocking to me that there are resources out there. Another thing that was really endearing for me is Giselle is 2 now, but at her last Cleft appointment, they asked me, there's a list of people that we go see. And on there, they said, the psychologist is here. I don't know if you want to see them, but they're here as a resource. And at that time we didn't see them, but it was just like, oh wow, that is so incredibly needed. Because I guess we think of all of I don't know, right? You think everything in the mouth, making sure that this is doing well, but I didn't realize that, wow, like medical care is like taking a next level step and saying, hey, how are you mentally? How are you doing? How are you managing all of this change, this process, this big thing, right? Accepting this news. And not only,
Mhm.
more specific for Giselle, right? And so I was really surprised that was there, and really excited, right? Like what an exciting thing for families to be able to have access to.
Absolutely. It is like, I think it's so cool when it's just there and now, like, okay, if I need it, right? Or even like, okay, I don't know if I need it, but I'm gonna check in with them because I know even like through my teenage years and adulthood, and I've seen this with families, you never know when you're gonna like, I call it kind of be like go through that grief process again, or like just be surprised that the emotions that come up. Because I think, for me, like I kind of forgot about my cleft in between surgeries, right? And so it's like you just never know when you're going to have to process new emotions or things that you thought you had processed. Because I think, there's not only the physical scars, but everything we go through, whether it's navigating all the appointments or therapy or, right, I think it can leave a little scar on our heart.
Mm. Mm.
And the goal as we are journeying is to make sure that that scar like can move well with us, right? That it doesn't get tight and hold us back.
Yeah. I have started to realize this, and I've actually been sharing this more often, but I didn't realize that how much emotion would come with recording this podcast. Like I said, I'll share my story and then I'll listen to other stories and I'll put them out there so that other people can kind of listen to them and understand about their diagnosis. And then it just came like this wave of emotion. It's like I someone will say something and I will have a physical response to it. Like I've even like my eyes water on the show frequently, and I'm just like, oh my God, I'm gonna cry. um
Right?
yeah, like not only hearing other people's stories, but just kind of like thinking about where I was and like my mind frame during a really difficult time in my life. And so yeah, like it is
it's
hard. It is.
it's hard, right? But I also think it is so beautiful. Like And I guess like one turning point too is when I realized like my cleft is this blessing in disguise, right? Like I wouldn't be who I am. I wouldn't be able to help the people I can help. You know, yes, maybe I was shy, but I think I was observing the world and I gained so much wisdom
Mm.
from that perspective. And so every time those emotions surge, I think it's a healing power. But beyond that, it's like we're gaining this superpower of like insightful living
Mhm.
almost that we can then take out in the world. And that, like, yes, maybe I was the other growing up and even as an adult, but like, thank goodness. Right?
Mhm.
Like, because the reality is the world, like, we're made up of others because we're all unique.
Yeah.
We just have a pro and different perspective of that as people affected by cleft and craniofacial, as parents, as families. So thank goodness, right?
Yeah. When would you say that you kind of gain this confidence that you have and just you mentioned just like observing the world and kind of like being able to kind of grow from that. But then you also say that you were really shy. But I wouldn't know if based on like our conversation you're and then we have a podcast so people tell me the same thing. They're like, "Laura, you're not introverted, you're extroverted, you talk all the time." But sometimes we're different in different spaces, right? But yeah, how were you
Exactly.
able to build this confidence in yourself?
I think it just, as a teenager, I did a lot of journaling. And so that was a really good tool for me, just processing. And I did a lot of reframing of like, yeah, just that reframing, even starting as a teenager. So just, I guess, being equipped with coping strategies and then taking that out into the world. I still do it today, right? And I think I had to do that younger because of my cleft, but most humans benefit from the ability to reframe emotions and all that. So maybe that's another blessing in disguise. And I'm sure moms can relate to this. So just, yeah, learning those strategies that make us overall more healthy emotionally and physically.
Yeah, because that was gonna be my next question. What do you think, like, parents should do to or even so like, what was something that your mom did that was really helpful to you in growing up and that kind of
I
yeah.
guess, yeah, I guess back to the question you just asked me, how did I develop those skills, that confidence? I just had this epiphany back to the beginning of this episode where we talked about how I would come home and she would pull it out of me,
Mm.
like, why are you sad? And she wouldn't give up until I like let it out. And so I know a huge part of it is probably just that space to process emotions, right? She taught me we process the emotions and then we move on, right? And then they're going to come up and we process and we move on, right? And we move on stronger because of it, I think. And I think as parents, you learn like how your child um, does that, if they're externalizing things or internalizing, and how it ebbs and flows, and just knowing sometimes a lot of times it may have nothing to do with their cleft, just normal
Yeah.
kid stuff.
But it's so hard because sometimes I feel like, you always think it's about it, right? Like, you always like, associate it, and I mean, I'm a first-time mom, and it's like, even, with Giselle as a baby, I everything is, like, cleft related, "Well, this is because of her cleft." Like, she had RSV, and I asked her surgeon, I was like, "Would she have done better?" Because she sadly was admitted into the PICU, and I asked her surgeon, I said, "Would she have done better? Like, would she have not been admitted if, if she didn't have a cleft?" And her surgeon was like, "Actually, she's more open than other kids, so she could probably breathe better." So I don't think so, Laura. But it's like you always think that it's, like, related to the
Right?
cleft.
But But see, that's such an awesome thing, though, that you felt comfortable asking the doctor that, the surgeon that, right? Or like we get that all the time in clinic. Like this is, things that should go to the pediatrician come to us. And honestly, I don't think we mind at all because we'd rather have you err on the side of like asking questions than, right?
Yeah.
But the reality is, like, from an emotional standpoint and processing the world, I think there's always a little bit of the cleft that's in there because you can't separate it. Like, yes, I'm done with surgeries, but the cleft is still a part of me. It's not who I am, but certainly a lot of how I process the world.
Yeah. That's interesting that you say that about the pediatrician questions because I'm so glad, like, oh, God bless the pediatricians, but they know nothing. I would rather go to my club team and they tell me
Yeah,
or an answer or what they think is an answer than to go to them,
yeah.
because when you have a child that has a cleft, it is so different. The approach, I mean, there are differences. I wouldn't say it's so different, but it's the approach to their care is different. One of the, like, the main things that I know, like when Giselle was born, she had a lot of reflux, like, and it's common with kids that
Mhm.
have clefts. She had a lot of reflux, and so she had to. We got her a wedge so that she could kind of sit up in her bed. Now, you tell any other parent that, they're like, you cannot have a wedge in there. They're going to, you know, God forbid something will
Not gonna be good.
happen
Yeah.
to them, and
Yeah.
they won't be able to breathe and that type of thing. And it's like, you just don't just it's like
Yeah.
all of these things.
And that's a huge role of the Cleft team to be that bridge. I used to be the director of the team, interim director, and I always said, like, I'm your bridge. Like, I describe our care coordinator. She's the bridge. She's your interpreter between all the normal child stuff, the pediatrician's office, the speech therapist at school, right? And we're here to bridge the gap in knowledge, and just also training them and to advocate for you and all of that. I'm always surprised, like, just like pediatricians, it can be the same thing with speech therapists. Like, they may not have a lot of experience in cleft, and not many graduate programs require a cleft course anymore. Not even, like, all graduate courses in speech do not require a pediatric articulation or speech sound
Wow.
course. So, as a speech therapist on the cleft team, part of my job is giving the local speech therapists the tools and knowledge they need to best serve the patients our team is seeing. So, yeah.
I wanted to move into talking about your team specifically. I see you online and stuff, and you really, like, talk a lot about your team, and you have really wonderful things to say about them, and I love that because
Hmm.
I think that hospitals and teams should be doing more of that. I think, like, I see these parents online and they're like, I don't know who to contact. And I'm like, how, this is, that should not be, or like, to what you were saying, even in, and this is aside from you all, but just in the medical system in whole, like nurse education, where I have some nurse friends that say, well, I don't understand why, your nurse told you that, because we were, well, we studied clefts on end. And then versus another team are like, well, they didn't talk about clefts at all during our nurse education. So I've seen that
Yeah.
happen, and I think a lot of
Yeah.
moms come with the approach that, like, I just wish everyone had the same standard of care, like the same,
Yeah.
like, everyone just
Yeah.
knew, so that our babies wouldn't have to.
Yeah.
suffer so much and go through the things that we go through.
Oh, I was gonna say, I think that's part of why, like, your podcast is so important, right? Like, we do have a lot of work to do for raising awareness. Like, a speech therapist should not say they don't know what a cleft is, or, right? But I think a really good resource is the ACPA, right? And the American Cleft Palate and Craniofacial Association, they are the scientific body that sets the standard for care. And I think it's an amazing effort and some really good progress to set the standard to make sure, like, if you are seeing a cleft team, here are the standards that they need to be meeting. So in the ACPA guidelines for team, there is something in there about how the team will communicate with the pediatrician,
Mhm.
right? And so when in doubt, parents should make sure they're seeing a team that is approved by the ACPA. And then if you need to interview multiple teams, go for it. Like, trust your mama gut is what I say. Like,
Yeah. What that brings me to another thing that I was thinking about, and this may be like very broad, but what are some questions that moms should be asking? I know like a lot of times they're like in the groups and stuff, they'll say, we're having our first team appointment, like give me all the questions that I should be asking. And just from your
mhm.
perspective, what are the questions that people commonly ask and what should they be asking?
I think first thing you can kind of expect a roadmap to, like, 30,000 foot view. What treatments should I expect my child to have? And knowing, like, some of these they may or may not need, but what at the bare minimum will be needed? What is the general timing for those procedures? Who on your team performs those surgeries? Who on your team is going to communicate with the speech therapist at my child's school, right? So early on, getting an idea of how the team functions. Who will I see at the team visit is a really good question. Um, can you give me a roadmap of what the sequence of their care is going to look like? Yeah, those are some things that come to mind off the top of my
Yeah, yeah,
head.
no, I like that. I love that. In fact, so are you this? You made me think of something particular to Giselle's care. She was born cleft with a cleft palate. I was always told that she would have to have speech like when she was born, right? But then when they had her evaluated, they said like, oh no, she's doing well. So then I kind of got like, I don't know, because I don't want her to fall behind, you know. And so I'm like, everyone's telling me that she's doing well, but I don't want her to fall behind. And so I'm not buying this whole idea that she's doing fine. So anyway, I got her evaluated like
Mm,
3 times.
mhm.
So
Yeah.
my question is actually like, I feel like every part of her care was under like her cleft team, but for speech therapy, they sent me kind of like outside of the team to get that part of it. And for UMN, do you see all of y'all's kids or your kids in-house for speech therapy, or are you just seeing them annually or when they come in for their cleft care?
So, at a minimum, we always see the kids annually, starting at birth or as soon as they're discharged. The frequency of appointments for evaluations may are really child-based, but it could be as frequent as every 3 to 6 months, especially in those early years where we're trying to decide, do we need to start direct speech therapy, or can we take an indirect approach and give you the tools to work things on at home?
Mhm.
Um, I always offer that we can see them for therapy in-house, okay? But for some families, just logistically, it would be a nightmare, right, to come. Some families are traveling 6 to 8 hours,
Mm.
right? Or even like 2 hours for an appointment would be really difficult. But we do offer in-house therapy, and I think that's important. If you can't get in-house speech therapy, like you can't come to us, then I may have you come in more more frequently for evaluations. So I may say, okay, for the next 3 to 4 months, we're going to work on this. I call the speech therapist, we come up with a plan, get their insight because they may have more knowledge than I do from a 1 hour visit. But we make a plan, and then it's really important that we're monitoring that progress. If we're not sure, like, well, they're doing well, but there's a few developmental speech errors that we want to make sure disappear, well, then I'm not going to see you back in a year. I might see you back sooner in 6
Mm-hmm.
months.
Yeah, because that's
So,
what they said. Oh, well, you would have speech therapy, you know, with this other company, and I'm like, well, I don't want the care to be like kind of this disjointed experience. I'd rather her just go to the speech therapist. And then they said, well, we could see her in house, there, but they
mm-hmm,
just don't usually see kids there. So it was that was the only part of it that was like
mm-hmm,
kind of odd. Like every other, I guess maybe because it's so often, right? Like a lot of kids go weekly or biweekly, right?
yeah,
Yeah.
yeah. Well, yeah, most kids will come 1 to 2 times a week. Early on, I may see like a 2-year-old, we may see 1 to 2 times a month. But I'm glad you advocated, and just know, like, if any of your listeners ever have questions, feel free to connect. I'm always happy. I can't obviously give specific advice to your child's speech if I'm not like evaluating them, but I think having a framework of what's normal, what should I expect is really important.
Yeah, and I'm glad you said that because
So,
that's my
y-
next question. So what what are the sounds that
yeah.
kids with cleft should be working on?
Yeah. Well, we really want to make sure that they are acquiring the sounds in a good progression. So, like before palate repair, I love if we can get like them producing M and N. I want to go into palate repair knowing they have those
Mm,
sounds. They're saying a variety of vowels. They can say these sounds. Before palate repair, we can be bombarding them with sounds like P and B. And then after the palate repair, the sounds we really want to be focusing on are the early developing sounds. So P and like pa, 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 ba, B, T, and D. I tend to work on the sounds in the front of the mouth first. Most kids who have cleft related speech errors, it's because they say more sounds in the back of the mouth. And so we really want to develop those front early developing
mm,
sounds. We know if we can develop get kids to know how to produce those early developing sounds, it even supports their vocabulary,
mhm,
right? And so the early developing sounds, we want to make sure we get rid of any they call them maladaptive, but basically sounds that are produced in the throat. So instead of saying puppy, it might sound like uh-e, or instead of bye-bye, it's uh-I.
mm,
That's what my speech was like as a child. So, right, bye, Bobby, a puppy was
mm,
right? Those are called glottal stops, and they actually, when kids are doing that, the palate doesn't function as well. So I know this is a lot and probably a whole nother episode, but we want to make sure we're getting those early developing sounds. We're eliminating those posterior, the sounds in the back of the mouth or the throat, and then really listening. Do they have too much nasality, or do they have a good amount of air coming and sound through their mouth to tell us how that palate is functioning?
mm. Yeah, no, that I think
I could go on and
no, that's really
on.
insightful. I was actually gonna say, what about a little girl that adds letters to the end? What do you think about that?
Oh, yeah,
Sometimes.
yeah. And so that's a really good point, though. Like, there are going to be patterns that are normal speech development, right? Like, it's normal for kids to drop sounds or add sounds to the end of the words, but those patterns should disappear by a certain age.
Okay.
And if they're not disappearing, then we need to do speech therapy. And we need to have a much lower threshold when we're talking about kids with cleft palate, who not only the cleft palate, but like eustachian tube dysfunction, where they've had fluid in their ears, and which is like learning to talk with your ears plugged.
Mm.
So we have to have a lower threshold because these kids are at risk, and we want to get them help as soon as they need it.
Yeah. Yeah, no, thank you. That's really insightful. I was going to ask you about your team as well. So, who is your favorite member? I'm just kidding.
Well, what I was gonna say,
Just tell me who is your team members
who,
are.
right?
Thank you.
Well, yeah, I mean, I love our surgeon, Dr. Rennie Daniel. I've worked with many surgeons over the years, and my favorite characteristic are when they see the value of the team and their team players. To me, you could be the most skillful surgeon in the world, but if you don't want to make decisions as a team, then you would not be the person for me. Because this is a journey that takes a team. There's like a surgeon is not a speech therapist. Can a surgeon decide when speech therapy or speech surgery is needed? No, we need a speech eval for that.
Yeah.
Now, the surgeon is going to figure out, okay, how can I correct this surgically, and is it medically safe and all that? But that's just one example of it takes a team. So my favorite team members across the country are those who see the value and work as a team.
That is such an awesome
And
answer.
and the top of the team is you cleft mamas, and your little cleft cuties and warriors.
Yes, for
So,
sure. I love that. And so now I want to talk a little bit also about the podcast. What made you start a podcast? How is it going? Tell me all the things.
yeah. Well, okay. Yeah, so who knew I would be hosting a podcast? I know my mother would have never guessed I'd be hosting a podcast after all the years of speech therapy. I love seeing patients. I enjoy, research questions. But one of my goals has always been to directly empower as many families as
Mhm.
I can. And so the podcast is just one tool for me to hopefully, again, be able to bridge that gap, like make sure parents are getting access to research
Yeah.
and those things that are a little harder to access as parents or to digest. So, yeah.
Yeah, I'm so excited for you. I was really excited to see it. I said, this is what we need. Like, we need voices in this space, voices that are empowering parents. I think that, as we shared at the beginning, it's so hard to do. And I think that it is worth it, though. I really do feel like, I have people reach out to me all the time that say, hey, sometimes I just listen to your podcast when I want to cry, and
Mm,
I'm like,
uh-huh,
I am
uh-huh.
crying there with you. But I think that you have a unique perspective because there are parents that want to hear not only stories from cleft affected individuals, they also want to hear stories from moms, but they really want to hear that medical side of it and that kind of, scientific part of it to like know and understand that we're not just like a bunch of moms crying on a podcast, but that like, hey, these are actionable things that you can do. And these are the people that are caring for your children. And it kind of, I don't know, puts a face to what sometimes we can feel is like a very sterile environment, right? Like a place where we feel like we can't
Yeah.
ask the questions and we can't challenge. And I want to encourage all of our parents to be able to do that. And hopefully what you're doing is breaking that barrier and building that bond between the people that are caring for your child and patient and doctor. Yeah.
Yeah. Well, thank you. It's an honor, and I'm figuring it out as I go. And
Yeah.
um, Yeah, we'll see what it becomes.
For sure. And I'm sure you already know this, but anything you need from us or me to support that effort, I will step right in. So please don't hesitate
Awesome.
to
Well,
ask me. And so
definitely.
I do have a few other questions. What is something that you wish people knew about children born with a cleft lip or palate?
Oh gosh, Laura, that question is huge.
Sorry.
Um, but I want parents, to know, like, it's gonna be okay. There's gonna be bumps along the way, but it will be okay. I think the general public, I would just like want people to know, like, we have amazing stories. So ask us about our stories. Gosh, I don't know if I like that answer.
Yeah, I love that answer.
Is it too?
I do.
Uh,
Well, because, I think that some people would say it's really hard for them to talk about their stories, so it is sometimes people aren't that responsive when people just come and ask, questions. However, it's so
yeah.
interesting because as you've shared, like we want to talk about our stories. Like also,
Mhm.
reason number 58 that I started this podcast is because I wanted to talk about my story with other people that wanted to talk about theirs. Like I wanted someone to kind of have
Uh-huh.
this outlet with, and so I agree with you. I think that clef is a superpower. And although it's not my lived experience, I've heard that word come up countless times from clef affected individuals and just what other moms have learned about people that are along the cleft journey, that it's really makes you different in a way that's so positive because your outlook on the world is so different. Yeah. um,
Yeah, and maybe that's like, because I'm like, I don't know how everyone would respond to that question of like, tell me your story, right? That can be deeply personal, but I think like approaching it with the lens that maybe they know something they can teach me something,
mm,
right? So instead of this approach of it's something wrong, of like, hmm, what do they, from their lived experience, what can I learn from this person,
yeah. Yeah. And taking the time
right?
to do that, to get to know someone. Yeah. I think that that's
Hmm.
really
And
valuable. What do you think your journey has taught you?
I think my journey has taught me that, well, I don't know what it's taught me. I don't know. Like, it's just my journey, right? Like, I know it's forced me to be stronger than I wanted to be sometimes, right? But like, oh my gosh, our capacity for strength is huge. It's taught me that I can't like do everything on my own, right?
Mm,
And when I was little, I needed my sisters to translate for me. I needed my team. I needed my mom and dad. And so I guess I was very independent, but had to depend on people, and that makes us stronger.
yeah, I agree. I love that. Well, that was my last question. And I told you,
It was a
and
good one.
I told you that every time people get to it, they're like, "Haven't I shared it already?" But
Uh-huh.
But yeah, Dr. Anna, I just want to
Yeah.
thank you so much for being on and for being vulnerable and sharing your story, but also sharing your expertise as well and just information about your team. If there's anything that we can do to support you, of course, we'll link all of the socials in our episode notes. But yeah, I just want to thank you for everything and for being on.
Well, thank you. I feel like I know you even better now. And again, just thank you for what you're doing. And you're amazing. Keep going.
Alrighty. And thank you all for listening to the Our Forever Smiles, Cleft Mom Diaries, and Support podcast. Be sure to subscribe and submit a review of the podcast wherever you listen. I hope that you've enjoyed this audio experience. Maybe you cried a little, laughed a little, but more importantly, I hope that you feel a little piece of reassurance and even joy in your journey. Talk to you next week. Hey everyone, it's Laura here. I'm popping in today because I need your help. If Our Forever Smiles has ever helped you, if you've learned something new, felt less alone, or found hope through this podcast, then I'm asking you to help keep it going. Creating this podcast, sharing stories, and building a space where cleft families feel seen and supported is something that I pour my heart into. But the truth is, I cannot do it alone. If we want to reach more families and provide even more resources, we need your support. So I thought of a creative way to do this. For just $2 a month, you can help ensure this podcast keeps going strong. For $5 a month, you'll unlock exclusive Moms in Real Life content, real unfiltered conversations about motherhood and career and everything in between. And then for $10 a month, you can get everything plus exclusive merch to show your support. If this podcast has helped you and you want to see it grow to help other families that are probably facing the very same challenges that you are facing right now, please consider supporting us today. Every dollar goes toward making a difference for cleft families just like yours. And right now, we'll be using the funds to elevate the show for production. So we'll be able to add more video and just get new equipment. And as soon as this community is established and we're able to do more, we definitely plan to go beyond the scope of just this community. We want to be able to support scholarships for new craniofacial surgeons. We want to be able to support global surgeries and just really spread our efforts to continue to make an impact in our community. I just want to thank you in advance, and I'm just so grateful that you all are able to support me and support this community here. And it's definitely something that I'm really looking forward to. The link is in the show notes, and I just want to do a shameless plug here. The Moms in Real Life podcast is so cool, so candid, and yeah, it's definitely something that you'll want to check out. Thank you all again.